Hello there. My name is Dr. Brett Kamenez. At Kamenez Chiropractic, we know that learning how to take care of our body differently, learning different habits, learning the true cause of problems, and not merely continuing to treat symptoms, is how we get the best results for life. So today we're going to be speaking about hip and knee pain. Now this is very, very common. The hip is one of the largest and strongest joints in the body. It's a strong, what we call ball and socket joint. It's strong, it's stable, it's there. The knee is also one of the largest joints in the body, and the knee, I always want you to think about as one of the joints that we consider sort of the middleman, meaning unless there's direct trauma to the knee, which can happen, of course, a lot of times knee pain is a result of problems from the foot below and or the hip above. So the knee again is that kind of middleman in the whole system. Now, in terms of hip and or knee pain, is this you? Do you suffer from morning stiffness, aching joints, loss of function, cracking of your joints, swelling of the different tissues as well too? And these swelling, these problems, they result in other areas, meaning we can have inflammation, pain, problems with the joints, eventually deformation of the joints, reduced ranges of motion. And one of the big questions comes down to, is this a normal result of aging? Is this just a wear and tear issue, doc? The answer is clearly no. Even though there are a lot of things, you'll see a lot printed out there about normal, quote-unquote, aging issues and things like that when it comes to your joints. And it could be a knee, a hip, it could be part of your spine, it could be any part of your body. The good news is your joints, our joints, are designed to last. They're designed to be strong and healthy. Research has shown that joints are designed to last somewhere up to around 100 or 125 years of age, between 100 and 125 years of age. Research has also shown that the lubricating, what they call coefficient, the friction in a joint is so low that normal or simple wear and tear really doesn't explain the whole picture. So our joints are designed to be healthy, our joints are designed to last. The question then becomes, of course, well, why do we have degenerative changes? Why do we have pain? Why do we have breakdown? And why do we have people that do have arthritis in their 30s, 40s, 50s? So why do so many of these problems happen? The answer is not from a lack of drugs or anything like that. The answer comes down to something very simple. Now, if we take any joint, if we take a part of the spine, if we take a hip, if we take a knee, the joint is designed to be in proper, what we call biomechanical motion. It's designed to be in proper alignment. So if we take this part of the spine here, when there is what we call abnormal joint stress, that abnormal joint stress puts uneven pressure, uneven alignment to that joint. What that causes is it causes a cycle. That cycle then leads to, again, that uneven pressure in the joint. That uneven pressure now starts to break down the cartilage. It starts to break down the natural shock absorbing ability of that joint. That breakdown then leads to what we call like fibrous adhesions, areas becoming more and more stuck, reduced ranges of motion. That reduced range of motion then leads into things like pain. Then the cycle just gets worse. Then we have pain and we have immobility. We can't move, we have pain. Then what happens? We start to move less. We have more pain, more immobility. Now it's not just the soft tissue of the joint, meaning it could be the cartilage. Now it starts to affect actually the bones themselves. Now what happens is the body, in an attempt to decrease the pain and to protect from further injury, now starts to lay down not just protection to the soft tissue, but actually to the hard tissue as well. It creates what's called now damage to the joint or even arthritic changes as well too. Arthritis is not really a normal result of aging. Now, When I say arthritis, I mean osteoarthritis. There's other forms of arthritis like rheumatoid and things like that. But osteoarthritis, or damage to a joint that affects now the bony structure, is a result of a joint that is damaged out of its normal position, out of its normal alignment, and left that way. And left that way, typically, how do we leave things? Not for days or weeks, but typically years and even decades. The body can take years and years of damage. You can actually see it right here. So we have a nice healthy disc. That disc starts to lose some of its height, some of its shock absorption value. Now these discs are vitally and very strong. So this takes a long time. This doesn't happen over a few weeks. It typically happens over years. And then what happens is the area or the joint starts to eventually lay down arthritic changes. And again, I'm showing you a low back, but this could be a hip, this could be a knee, this could be any part of our body as well. And again, remember, arthritis, damage to joints is not age-related. That's a lie, it's a fallacy. Yes, of course, there are age-related changes that occur in our bodies, but the majority of what happens to joints has been studied and shown, especially to the bony part, is result of arthritic change, as a result of what they call those incomplete compressive forces. Most of the age-related changes happen really to the soft tissue. Some of it will happen to the disc, some of it to the surrounding tissues, but the age-related changes do not, in the research, show that it affects the joint nearly as much. Now, we've thrown around some words: incomplete compressive forces to the joint, improper loading to a joint. This sounds like something, and for a lot of you who have been to the office already, I hope this starts to ring a bell. This is called, what we call, a subluxation. A subluxation is a misalignment of a joint, could be a spine, could be any part of the body, and that misalignment typically will put pressure on nerves. That misalignment accelerates damage to the joint, it reduces the range of motion, it accelerates arthritic changes. This is exactly what we're talking about. So subluxations, misalignments of joints in areas that become fixated and start to break down. So that immobilization, one of the best ways you can damage your joints is to immobilize them. Put them in a cast. Don't move them for a few weeks. Damage or immobilization will start almost immediately. Part of this problem, part of this cause, is our what we call lifestyle. We sit too much. We don't exercise enough. Once we have problems, once we have damage to joints, what do we tend to do? Well, we'll talk about, unfortunately, how covering it up doesn't cause the problem, doesn't correct the problem. It only makes matters worse. And part of the problem, especially getting into knees, is the fact that we walk on very different surfaces than we did just really, let's say, 100 years ago. Years ago, we had nice, soft ground, dirt, grass, even sand, that to an extent was able to give even a little bit. Most of us nowadays are walking around, if we're lucky, on carpet, but for the most part, concrete floors. The floor, our base now loses that shock absorption. This causes, every time we take a step, and for those of you, and I hope all of you have tried a pedometer at some point in your life, on a daily basis, I mean at least 5,000 to 10,000 steps per day, not counting exercise or running or any of those things, is normal. 7,000 to 10,000 steps per day. Every step we take on that hard concrete floor now causes more shock absorption. It's not coming from the ground. The ground isn't moving. It has to go somewhere else. And that somewhere else is traveling through your body. It goes to the foot, the ankle, the knee, and then through the hip, and actually to your entire body as well too. It accelerates what's called flattening of the arches or pronation of the feet. That pronation then turns in the hips and creates this ripple effect of damage throughout the entire body as well too. Unfortunately, we live in a very different society in terms of the impact of our health than we did, again, just 50, 100 years ago. Many of you watching this sit for 8, 10 hours a day at work. Even those of you who don't sit, I find typically that don't sit classically at work are still sitting, whether it's driving, computer, meals, for at least a few hours a day as well too. Sitting's another big factor, but I want you just to start to understand the process of how our bodies break down. We tend to want to focus on simply the treatment options. without really thinking about what's the cause. If we never go after the cause, and this is really one of the big takeaways I hope you get from today, is if we never go after the cause, we will never correct the problem. Never. This is the chiropractic mantra. What is the cause of the problem? Simply treating the pain, simply treating effects, without going after the cause will never correct the problem. It can never correct the problem. It may cover it up. It may temporarily reduce some of the pain and inflammation. A lot of times, treatment for pain, whether it's hip or knee issues, involves over-the-counter, NSAIDs, things like that, over-the-counter pain relievers, sometimes more serious pain relievers. And I'm not saying that they don't serve a purpose. There's never a place. You got to get a good night's sleep. I absolutely get that. But long-term use of NSAIDs, long-term use of pain relievers has actually been shown to increase damage to the joints, more arthritis, more degenerative changes. Why? It's simple. You're covering up, you're masking the symptoms. Pain is never the problem. Pain is the body's alarm system. It's a warning sign. The fire alarm is not the problem. The fire is the problem. If we disconnect the fire alarm, we may not notice it for a while. We may not notice the pain for a while. Unfortunately, it's only going to get worse. We need to fundamentally change something. And many times there's something or a lot of somethings. And I'm going to start to get into those as well. But the good news is that changes can occur. Healing can absolutely occur in our body, even once there's damage. Damage to a joint, damage to a part of our hip or our knee. Research and studies have shown that within 5 years, 10 years, sometimes much less than that as well too, that joints can actually heal, joints can actually start to regenerate as well too. And here's a great one I wanted to mention as well. So Dr. Bland in Biomechanics of the Knee talked about how arthritis of the knee can actually be reversed by, now remember this isn't chiropractic literature, can be reversed by an alteration of the associated biomechanical factors. The indirect inference being here is that identifying, recognizing, and correcting what they call the kinesiopathology, the alignment, is paramount in the arrest and reversal of degenerative changes. Now again, this isn't chiropractic, but what they're talking about is changes of the altered and the biomechanical factors. That's it. The alignment of our body. They're saying subluxation, but they're using different words. So the reality is one of those big factors in terms of getting the body back into proper alignment and has to come from chiropractic care. Getting the body in its proper alignment, getting pressure off the nerves, getting joints into their natural and normal alignment and motion pattern has to be key. It's one of the most important factors for you and your family. Number one, it stops the damage from getting worse. That's where we always have to start. We have to stop it from getting worse. Again, if we only look at treatment options and we never correct the cause of the problem, we're unfortunately doomed to failure. We stop the damage, we get the joint back in its normal and proper alignment. That gives your body and the joint, any part of your body, some rest, some time to heal, some time to relax. Now that healing can take years, and we have to start somewhere. That proper alignment, though, doesn't have to start, by the way, when you have pain. I recommend that at any point, especially when we're younger. Little falls, accidents, stresses, injuries create bigger problems when we're adults. Most patients I see, it's not a recent thing. They've had chronic issues sometimes throughout their entire lives, from little accidents to falls to sports injuries. As a note, I always recommend people, and especially get their kids, checked simply for alignment, check their posture, have me check their gait, because it's going to make a big difference in terms of how they function. We may check them and everything's fine, and we may check and say, hey, this is an area that can be easily corrected and not become a problem down the road. So how do we start to correct this problem? Number one, again, simply proper alignment through chiropractic care. That's a key. Keeping our body in proper alignment, keeping motion in the joints, number one. Number two, we've got to have more of that motion in the joints. Motion creates healing. The motion pumps blood and nutrients and everything good into and out of discs, joint areas. Again, motion is life, and life, what we call, is motion. This is one of these mantras of how the body works. Life is motion, and motion is life. So we may not be ready to run that marathon yet. That exercise, though, is something I want everyone thinking about either now or at some point in the horizon as well too. But if we can't exercise yet, let's say, we can almost always start with at least some light stretching. These are ones I'll typically prescribe in the office. Stretching of the joints, stretching of the body has to happen. Again, we sit too much, we have other things, we commute, areas will break down much, much faster than they're designed to. Not a good thing. How do we also, one of the big things I want to put out there is what we take into our body. Chemically has a big impact as well too. As a side note, smoking is a huge factor to accelerate aging and damage in the body, especially to the discs in our body. That would be one huge thing I would consider either giving up or eliminating. And of course, we have to start to talk about nutrition. Nutrition is a huge one as well too. So nutrition comes into, of course, not just what we eat and not just supplements, but really everything in terms of water and everything else as well too. So nutrition should start with a properly balanced diet, of course. And supplements should be what they're called, supplemental. They're nice, they're good, they're there. I'll make some recommendations, but really we should aim to meet our nutritional needs pretty much through diet alone. How do we get some of these good things in? It all comes down to the basics. Fruits, but really primarily vegetables, green leafy vegetables. Watching and also trying to reduce inflammation through your diet as well. Trying to eat foods that don't create more inflammation, help to reduce inflammation. Again, those green leafy veggies, anything that creates more of what we call like an alkaline effect in our body. The foods that tend to create more acidity, again, the fried foods, other things like that as well too. And the foods that tend to create inflammation in our body. It's different for everyone. For some people, they have reactions to gluten. Some people not. Some people more dairy. But again, more of those green leafies you can get into your body, the better. Supplements. Supplements are good. Some people I find respond very well to a glucosamine chondroitin joint type support to help and aid in this process. What I usually recommend is use it for a few weeks, see how you do. One big supplement I will recommend, unless you're a vegetarian, numerous and literally tens of thousands of studies have shown a good fish oil is a great supplement. The reason is it's great for the heart, but it helps to reduce inflammation in the body. And again, if you're a vegetarian, there are alternatives, flaxseed oil, hemp, things like that. But most of us, a good quality fish oil. And for more information about that, come talk to me personally. Some of the brands we recommend and some we recommend to stay away from. But there's plenty of good stuff out there to take as well. Again, keeping your body in proper alignment. So we have our proper alignment in our posture phase. Then we have what I call like the chemical piece as well too. So what are the nutrients we take in? Are they adding to the inflammation or are they reducing that inflammation as well too? Obviously water is a huge factor, and increasing the water is something that most of us could benefit from as well. And then movement, and then physical movement. Stretching to start off with. Exercise is a huge deal as well too. Getting our body functioning, getting our body to heal, getting it to move. And just a couple other ones I wanted to read to you as well too. Again, studies have shown, Journal of Bone and Joint, the nucleus of the disc of your spine, this part right on the top here, retains its ability to regenerate within 6 months. Alteration in the biomechanical factors proven to reverse osteoarthritis in the knee. Again, kind of the same thing. This other journal of surgery and orthopedics talking about how getting areas back into proper alignment makes the biggest difference and can help. Now, there are some times when we get past the point of, unfortunately, what we would call no return. But we don't want anyone to get to that point. And the reality is, what I always say is, as long as there's a breath of life in your body retains an ability to heal. I can't tell you how many patients we've had Not that, I mean, scheduled, sometimes for surgery, other things. If you're willing to put in the work, if you're willing to put in the time, if you're willing to make the changes to how you live, how you eat, how you move, your body has an amazing and miraculous ability to heal. What you do is you start to tip the scales in your favor. It's a seesaw. Now, it doesn't mean if you do everything right, nothing bad's going to ever happen to you in your life. But the better we take care of our body. Now, our joints are part of that factor as well too, but looking at everything, the better your body is going to last and take care of you. Earlier on, I mentioned how joints are designed to last 100, some say as high as 125 years of age. That's the goal. It's all about quality of life. And that's what we're about. That's what chiropractic is about. Our goal is to help to transform lives. That's what we do here at Kamenez Chiropractic. We help to transform lives. We help to take many of us who've gotten off track. We are working. We've got families. I get it. I'm in the mix too. And slowly, over time, to start to move us in the right direction. Transforming a life, it's not going to happen in 40 days, I can tell you right now. Changing how the knee, the hip, I mean, these are factors. These are things we can work on, of course. And we can get you to feel better. And you can make some changes to how you feel very quickly. But to truly transform your life and your health, a lot of times it can take years. It does take years. It probably took you years to get unhealthy. You probably, 5 or 10 years ago were a lot healthier than you are now. And so that's okay. One of the takeaways is, number one, that proper alignment is key. Being aware of your posture as often as you can. Starting to get, if you're not already, making sure you're getting a checkup with hopefully myself or another chiropractor in your area for proper joint alignment, proper biomechanics from everything from your feet and your knees and your hips and everything up. As a chiropractor, I also have a specialty with extremities. So how a foot and knee can affect alignment of the hip and mid and even neck area. All sorts of areas like that as well can be connected with our body as well. Proper alignment has to start to stop the damage. Then we support it. We stretch, we exercise, we get areas moving as well too. But again, the good news is our bodies retain an incredible and amazing ability to heal. We've given you a lot. I've given you a lot of takeaways. I've given you a lot of things to hopefully think about. But number one, I want you to think about the good news is that your body is designed to heal. It is. It's designed to be healthy. Now, you may be in pain right now and thinking, I'm not thinking about health. But the reality is, once we start to get through that pain phase, then we can focus on not having the problem return, gaining more strength, gaining more flexibility. Again, tipping those scales in your favor so that the likelihood of this coming back reduces, the likelihood of your body to live long, to be strong. You're in your 90s doing push-ups, you're not in your 50s in a wheelchair. That's what we want. We want, and our bodies were literally designed to be strong and to be healthy and to last and to support you in this life. It's a great and wonderful thing. Here's my goal and here's my challenge to everyone watching this as well too. Share some of this information. Tell a friend, tell a neighbor, have them and tune into this YouTube video as well. Send the link to someone. We love to share great information. We love to also invite people into our office. We offer preliminary screenings for everybody in our office. That's a great time to come in and sit down and touch base with me for a few minutes to see if you might be a candidate for at least a more thorough checkup in the office. And sometimes it's just, hey, you're good, and we'll maybe check back in X amount of months. So you've done great. We've gone through a lot of information as well too. I hope everybody has a great day. I hope you take some pieces from this workshop and you start to implement them into your lives. But remember, even if you have joint and knee and hip and all sorts of problems, your body can heal. Start with some of the pieces we've worked with. Start working them in and give it some time. Thank you so much.